Welcome to Medically Speaking. My guest today is Bridget Hughes from Oshai Children's Hospital. Today we're going to talk about genetic diseases, in particular leukodystrophy. Bridget, thanks for joining us today.
Thank you so much.
Let's start off. Tell us a little bit about yourself, how you end up at Children's.
Yeah, sure. So I'm originally from Buffalo and left Buffalo for a few years to go to medical school and do my residency training. And in my training was very interested in kids with complicated health conditions and chronic health conditions. And so had the opportunity to come back to Buffalo once I finished my residency and work here in Oshai as a general pediatrician, but specifically taking care of kids with complex health needs. In some places, it's called a complex care physician. And so I've been here for about 3 years, work at Niagara Street Pediatrics in their special needs clinic, and then at the Robert Warner Center, where I've been excited to be a part of the new leukodystrophy program here as a complex care doctor.
Well, it's great to have Buffalonians back in action and working at Children's. Let's talk a little bit more about leukodystrophy and those complex issues that you deal with. What exactly is leukodystrophy?
Leukodystrophies are a group of rare disorders that affect the white matter or the myelin of the brain. Myelin normally acts as an insulator around nerve cells to try to protect and secure signals that would be traveling to and from the brain. And there are many chemicals that make up that protective myelin. And leukodystrophies are due to some sort of problem or breakdown with the chemicals that make up the myelin that leads to damage of it. And so if the myelin isn't functioning the way it should, the brain can't send messages to the body in the way that it's supposed to or as effectively or efficiently as it should. And that can have a huge impact on how the body functions.
How is it detected? Is it if someone comes in with their child that they're having some of those challenges? Is it something that's detected before birth? Walk us through how the detection process works.
So a couple of leukodystrophies can be detected on the New York State newborn screen, meaning they can be identified soon after birth, which allows a child and their family to get treatment and evaluation very quickly. However, most leukodystrophies are not detectable that early. And so the age of onset of symptoms can vary based on the type of disease and the specific child. And so in infants, they might present to their doctor saying that the family is seeing developmental delays or they're seeing neurologic changes. In an older child, you might see gait or vision problems or behavioral changes, or that they lost milestones that they previously were able to do. And then there's some leukodystrophies that don't present until adolescence or even adulthood. And so those may present with psychiatric symptoms or behavioral changes later on in life.
So what's the incidence? How often does this occur when you look out, to a Western New York population or across the United States? Is this something that is rare or is it pretty common?
Overall, it's rare. So there's more than 50 types of diseases that are categorized as types of leukodystrophies. And so the specific incidence of each disease varies, but the combined estimated incidence is about 1 in 5,000 live births. So individually, they're rare, but combined, they're not quite as rare.
And let's talk about treatment or life expectancy and maybe how that has changed over the years. What's the current treatment protocol for leukodystrophy?
Depends a lot on the type of the disease. In general, leukodystrophies are neurodegenerative, meaning that over time, without treatment, the disease can progress, causing more destruction to the white matter of the brain and worsening symptoms. However, depending on the type of leukodystrophy, there are some treatments available, such as cord blood or bone marrow transplant or gene therapy that can halt the progression of the disease. And so in those cases, if you're able to diagnose and catch the disease early, you may be able to stop a child or a patient from having worsening symptoms over time. And even for diseases where there aren't yet big treatments or things that can be done to completely stop the progress of the disease, all of these diseases are very treatable. There's many things that can be done to help a patient's health and their quality of life. And that's because most leukodystrophies involve a lot of different organ systems of the body, since the brain isn't able to communicate the messages and information it needs to anywhere, everywhere in the body. And so a lot of these patients will have problems like poor nutritional status, seizures, muscle pain or muscle spasticity, sleep apnea. And if you can effectively treat those conditions, you can really improve the child's health, quality of life, and often even duration of life.
So when you look out, has there been a big change from the treatment or expectancy side of things from when you first, got into medicine up until now as you start to treat this?
Yeah, so over the past years, there have been some huge advancements. The bone marrow transplants and gene therapy are all fairly new treatments, and for the diseases that those exist for, they've been life changing for patients and families. And then there's lots of exciting research going on trying to explore other types of leukodystrophies and looking at things like enzyme replacement therapy and gene therapy for other cases. And so think there's a lot of hope that in the future there's going to start to be a lot more treatments for the diseases that we might not have something as new for.
Well, obviously that's exciting news, and that probably goes hand in hand with the new clinic that's opened up at Children's, the Robert Warner Leukodystrophy Clinic. If you can, tell us a little bit about that. What ages does it treat, and how far in terms of population are you serving right now?
Our clinic treats kids from birth through age 21, and we see patients who have either a diagnosed type of leukodystrophy, one of those 50 plus diseases, or a suspected leukodystrophy. So if they're undergoing testing and workup, but we're not sure yet what they have, we are able to see them too. And we provide care from initial assessment through transition to adulthood. We are a multidisciplinary team. So, in addition to myself, it includes a neurologist, a neuropsychologist, a dietitian, a physical therapist, and a nurse coordinator. And we work closely with our hospital genetics department since these are genetic diseases, and we work closely with genetic counselors and geneticists. And then we also have the ability to work closely with the other specialists the patient may see, as well as with a community organization called Essential Care, which provides a lot of symptom management and palliative care to children in the community. We're able to see, any child or family in Western New York, so we don't necessarily have a geographic radius. There's about 10 to 15 other leukodystrophy centers around the country, so they're not especially common, but any family that might not be served by somewhere closer to them could absolutely come to our center.
Having the clinic is an important offering for the patients. What's your message to parents, that have to go through this or that may be dealing with a challenge like this?
Our goal and our hope for our clinic is that our team-based approach will provide support to families and be with them as their child journeys through this illness. Our hope is that by seeing a team based all at once, they'll be able to get more addressed at each visit and hopefully have less medical visits and better collaboration and coordination for their healthcare. And we also work closely with Hunter's Hope Foundation, which is an amazing community organization that promotes care and research and treatment for families and children with leukodystrophies. And so they're able to be a big support for families in terms of connecting them with education and support groups and that kind of thing.
Important stuff indeed, Doc. Appreciate your time today, talking about leukodystrophy and all the breakthroughs that you guys have had, especially with the new clinic that's open at Children. So once again, thanks for joining us today.
Thank you so much.